फ्रेंड्स नेक्स्ट आप एक वीडियो देखने जा रहे हैं जो कि अमेरिकाज बिजिएस्ट इमरजेंसी रूम एट लॉस एंजलिस काउंटी हॉस्पिटल। बहुत ही इंटरेस्टिंग वीडियो आप देखेंगे और ये वीडियो का कोऑर्डिनेशन करने के लिए आई विल इनवाइट डॉक्टर मालव शाह फ्रॉम HCG हॉस्पिटल। ही इज़ MD physician. He has done an advanced certificate course in management of diabetes and cardiovascular diseases. He has wide and well experience to handle all kind of emergencies including cardiac, critical, pulmonology, medicine, orthopedic and many others. Emergency physician consultant, head of emergency department, HCG multi-speciality hospital. और एक ख़ास बात डॉक्टर मालव की है दैट ही ऑल्सो स्पीक्स रशियन वेरी वेल। सो प्लीज़ वेलकम डॉक्टर मालव।
Hello students. Good afternoon. लंच के बाद सो गए? So today we are going to see a video about emergency medicine and emergency room. Can anybody tell me what is the emergency medicine or emergency room? Okay, it's a very unique, very exciting, very new branch of the medicine. And this is the most live branch of the medicine, and you will face all the kind of emergencies all the time over there. We all know that we are all mortal. जो आया है दुनिया में उसको तो एक दिन जाना ही है, but we are all like boss આપણને તો કંઈ થવાનું જ નથી, આપણને તો યાર કંઈ થાય જ નહીં, એમ તમે ખોટું કહો છો એવું જ કે બધાનો એટીટ્યૂડ આપણો સમ એજ સુધી તો એવો જ હોય. But when we get sick or we have any emergency, we met an accident or our family member or any near one get passed through this kind of emergency, that time only we can realize that yes, we are all mortal, right? We have to die. It's a nature thing, and all that emergencies will be handled by an emergency room. And nowadays there is a special physician who can handle these emergencies all the time. He has the knowledge of all kind of subjects, and he has to be ready for all the time. Soon you are all going to select a path for your future. So you all must be thinking that ભાઈ પૈસા મળશે કે નહીં આમાં. પહેલો ક્વેશ્ચન બધાનો એ હશે કે હું જે પણ લાઈન લઈશ સારું કમાઈશ નહીં કમાવું, how I will earn. Respect. Will I get the respect? Does this branch has growth? If you ask me, yes, definitely. It has lots of respect, lots of growth, and of course, money also. And the addition to all these things, you have one more thing, that base satisfaction feeling that you are saving a life every day. Saving a life of anyone, it's a great thing. Am I right or wrong? Right? So, like each profession says its own benefits and disbenefits. This profession also has some disbenefits, like you have to stay awake at night and you have to run to the hospitals in the emergencies, and like you have to stay away from your families for odd hours, all that things. But even soldiers, police, all are doing that kind of job, and every profession has this kind of disbenefits. So we have to accept that, and we have to follow the new branch. Now we are going to watch a video in some parts, which is about the emergency room and emergency medicine. It's from the Los Angeles, the USA. It is the most busiest emergency room in the world. we have little bit different system. So in between, I will try to explain you all the things, how the emergency room works in India and outside India. And I hope you will all enjoy and you will get idea about the emergency medicine and emergency room by this video. Can you have video number 1?
Yes, base. Go ahead, rescue 2.
I'm here with approximately 21-year-old male, down pulses, apneic and unresponsive in the middle of the street. Patient sustained 2 gunshot wounds.
What's your ETA to our facility?
Actually probably about 7 minutes.
7 minutes to our facility, 21-year-old male, multiple gunshot wounds to the left and right chest, is that correct?
Yes.
This looks like total chaos. But as a doctor, I see unity in that chaos. There's a team here, and all of that
Just continue.
coming together to save someone's life.
Chest tube that side. Okay, you two need to let the doctor in to do a chest tube over here.
But I feel like that spirit is not at all involved in this debate. And I think that this healthcare crisis.
So this is the emergency room. Very loud. Everyone is shouting. Please, mara patient mate kai karo, mara relative mate kai karo. Bloody. Blood is running through any part of organ. You have to stop that bleeding. Chaotic. Many patients are coming in bulk, like 2, 3, 4, 5, all at same time. But you have to be ready for all these kind of things. And believe me, it's very interesting. Further videos will show how we have to handle that kind of emergencies at the same time. Please.
Crisis is all about teamwork.
And therefore the law of the land.
The individual mandate that requires all Americans by insurance has deeply divided America.
Not one. Lawrence, you don't know who I am. You liars about government health care.
Our freedoms are shrinking.
You can afford health.
And he's a doctor, they get sent to the emergency room. So we're getting trained in this atmosphere, and I don't think our role has really been defined, and I don't think our voice has been heard yet, our generation of ER docs, and I think it's gonna be important to kind of put our stamp on it and say, you know, what our relationship with patients is gonna be, what our relationship with the business of medicine is gonna be, and healthcare in general.
I remember my dad always encouraging us to look out for the little guy. You know, if there was that awkward kid in our class in elementary school, you know, he'd want us to be his friend, you know, and make sure he felt like he wasn't alone, you know. And I knew that my life had to mean something, you know. I had to do something that was, you know, of service to the world. It couldn't just be a job to make money, you know.
Take a slow, deep breath.
Someone is suffering, what are you gonna do? Being a doctor, I have the capability to relieve them of their suffering. So that's what I'm gonna do, regardless if they have money or no money.
Hold still.
And it doesn't get any more complicated than that.
Other than like just boasting that you have to know. So in emergency room, there is a team leader who will guide everyone. There are some doctors, junior doctors also, senior doctors also, but it works on a teamwork base. So a leader will guide all the people, all nurses to do what to do, when to do, and how to do. So they bring all the knowledge at that time and they handle the emergencies. And they can have like fractures, cardiac arrest, heart attack, paralysis, bleeding, minor bleeding, any kind of like poisoning, burning, कुछ भी ले लो आप, जो भी माइनर से मेजर लेके कुछ भी होता है, we have to rush to the emergency. And they are trained for all these kind of things. And you will get the immediate treatment, which are called as golden hours, which can save a life. And the team leader, he is the specialist in the resuscitation. The resuscitation, which will save a life, which can save life like immediately. And it's most important. And all, believe me, all are not expert in that. So you require expertise in that thing to do a resuscitation. Now videos will show how to do resuscitation, how to coordinate, how they work as a team, right? So please.
When we started this, it seemed so simple. We were going to be doctors. We were going to help people. But what if those ideals can die? I mean, what if those hopes can fade into the failure of the system? If you're a young doctor, you have to ask yourself, how do I protect the ideals I came here for? Fourth and final year of med school, it's customary to kind of like go on extended auditions at a bunch of hospitals because now you got to choose where you're going to be for the next few years to train. At that point, I don't think I had decided, oh, I'm going to be a county hospital doctor. That's for me. I just heard good things and I was curious.
One, if you can pick up, you have a call line.
Skin falling off everywhere. We're on the old stuff on the tube. And there's no history. Approximately 50 males down on the seat on the ground.
You all saw that chest compression, right? It's very, very useful. And like in USA, each and every non-medical person even getting the training for this kind of chest compressions. It can save the life of everyone. Like any patient have cardiac arrest, heart band ho gaya hai, this compression is very helpful. And in USA, it's compulsory for all. In India, we medical personnel are only doing that, but in USA, everyone knows about this kind of compressions. And we have to do this all the time, all the day. CPR, yes. It's a cardiopulmonary resuscitation. Cardio means heart. Pulmonary means lungs. When heart gets stopped, the circulation of whole heart will stop. Whole body circulation will stop. So automatically all organs will start working. So when you do the compression, this kind of compression, there is some ratios, particular you have to give 100 compression in a minute, and all that kind of guidelines are there. But that compression will keep pumping of heart. It's just a try, but we are trying to keep our heart pumping, which has stopped. So by doing that pumping, that heart will supply the blood to lungs, which provide the oxygen, right? From lungs, our blood carries the oxygen, which oxygen goes to brain. So if you won't get the circulation to even brain, then person will be brain dead. So starting of these compressions are very important. And one should know this compression, how to do, when to do. So I will advise everyone to get a knowledge about this CPR later on whenever you get the chance, but definitely you should take a training on that. Now we will continue with the video because we have limited time also. So.
I mean, from day one, oh my God, it was just, initially I was like, man, this is like kind of crazy. I don't know if this is, like, is this real? Can this be true? Like, is this really for real?
I'd been at other hospitals, I'd been at other places, never seen anything like this before. You know, who's the doctors here? Who are the nurses? Who do I even talk to? It's my first day, who do I report to? And I remember saying, this very calming man. Turns out it's the chairman. This is the chairman.
See, this is the man about whom I was talking. He is the leader. He is the leader in that emergency room. He is very experienced. He knows everything, and he will guide everyone what to do, how to do, and all that things.
At the time, Dr. Ed Newton, but I don't know this. I just think it's a doctor. And I walk up to him, and he says, "Oh, you know, you're the new med student." And I said, "Yeah, you know." And I'm like, "What is this?" And he said, "It's C booth. This is where our specialty was born. This is where everything happens. This is where you know you're really gonna learn to be a doctor." And I remember thinking, how the hell am I gonna hang here?
Guys, bag him in the hall. Hey, I was gonna drop him to the head. All right, what are our vital signs here? Right? Put the down to the side. Needle in your arm. Deep breath. 50 patient.
30 of autonomy. Slide him up. Slide him up.
Again.
Slide him up.
Slide him up!
થોડું આગળ હશે.
Big population in this huge city end up in here in C booth, and they keep pouring in, as you can see.
And it's true that people would come here on tours when we would do tours for the residency. People would come to interview, and they would want to see C booth, and they would know what it was. Let's see C booth, and the invariable response was, "That's it. This is C booth." It's a very small area, but again, I always tell people it's what happens here. It's not.
So these kind of situations will be in the emergency room. You can see 1, 2, 3, 4 patients are together. All are fighting for their life. Sometimes you can find some routine, very stable patients also with them. But for individual, for each and every individual, like one person's daughter have high-grade fever like 104 or 103. One has low sugar, and one is fighting for his life. But for each and every one, it's emergency. Nobody will say that, "Oh, my fever is not like that. Just go and see the other patient." Everyone wants, "Pehle mujhe dekho, doctor. Mera kuch karo." Right? This kind of situation we feel every time. But we have to accept it. We have to talk with patient and patient's relative. We have to make them understand that, okay, we are attending you in a while. But you have to be ready. Students, you have to be ready. You have to be very energetic whole day to handle these kind of emergencies back to back. You have to be ready for the emergencies anytime. Okay?
The physical space itself.
Please step out. You guys clear out. Thank you very much, gentlemen. All right. Here, Salim, I need some breathing. Okay, fine. All right, guys, I need a space. The stab one to the chest is here. Okay, no rectal tone. I need an abdominal pad. If you can give me an abdominal pad, please. Some more 4x4s.
I heard this was a very difficult and rigorous place to train, and you're constantly deciding, is this me? Do I fit? Can I do this? What's the deal?
Is it in? Is the tube?
Yeah, it's in. Call our team.
Okay, this isn't very good. What happened?
What happened?
Did he wake up?
Going in. No, he didn't wake up. I think the balloon I think it backed out.
How's the filming going?
All right.
Okay, can you take this out now? Take it out because he's gagging.
Has he got that accommodate?
You can't read about that stuff. You can't learn it in a medical school. You know, no matter how many times you've read or even done a chest tube under casual circumstances, it's very different from placing a chest tube that needs to be placed in 30 seconds.
All the way in, all the way in, all the way in, all the way in, all the way in. Pull it out open. Good.
Here, Gush.
Good. There you go.
It scares the hell out of you, and it makes you have to work hard, and there's no excuse.
Give me a good breath.
Bilateral with bagging.
So, Jen, can you hold that for a second? Can you troubleshoot your tube?
When I rotated here as a medical student, I saw how the seniors just commanded the place.
Bag, I need a bag.
Let's go, dude. Take that off. Go.
And I thought, I want to be that person. I want to be that calm and that cool, that collected, that knowledgeable, that confident. That's what I want.
All right, what are our vital signs here?
They're over here, actually.
135. Okay, switch her over to that one, please.
Emergency medicine calls a certain type of person to work there.
So you can see that that person is very cool and calm. He's not losing his temper, right? So you have to develop this kind of quality in you. When you are working in an emergency, you have to be very calm, and because if you will be calm, you can take very good decisions. And in emergency, what you require is a perfect decision. As in this video, they told that inserting a tube in chest, we can try in our practice many times, like in undergraduate or postgraduate. You will try many times. You will be under someone's guidance. But in this case, or this kind of cases, you have to take a decision of inserting a tube within seconds, and you have to perform that thing within seconds. So you have to be very professional. You have to be very talented. You will get it by experience, by doing again and again and again. Sometimes we get fail also in doing procedures also, but it's obvious. It's all blind procedures, and you have to do all the procedures all the time, like doing intubation or inserting a tube or giving a CPR. It's not cup of everyone's tea, right? So it's a uniqueness of emergency medicine. Now we will see how we try for this kind of patients and what outcomes come over there.
I loved making everything in life like huge, I love running up mountains because you get to stand on the top at the end and you feel, it's like in Rocky. You get that same feeling. That's what life is about, is, making love to a woman and making it seem more thick of it, fighting to save someone's life.
Chest tube that side. Correction. Go ahead and extend the thoracotomy over to the right side. Watch your knife. Here's a knife. All the way down. Yeah, so she'll work on the bottom, she'll work on the top.
Being a new doctor, I think optimism overshadows realism, and it's easy to see why. They fixed the wound. He had blood, but there was no life. It's this unfair exception to everything we're taught, that as a doctor, beyond your values, beyond your science, the system is sometimes bigger than you.
2.2 last hemoglobin. Okay. Anything else to do, Pep? Your case.
I think we call it.
Okay, we're calling it. Time of death, 11:46.
So these people work for 1 hour at least. This is the basic criteria. But every time we won't get the positive outcome. Most of the time we get negative outcome, because this is the only field where we have to work from the retrograde wise. Heart has already stopped or already damage has been done. Now you are trying to bring it to the normal thing. And it's not that routine. Patient has come by himself on war, or just relatives have bring them, okay, just आप इनको check कर लीजिए. No, it's not like that. His heart has already stopped, or he has broken his ribs. He has lots of blood in his lungs. All these things has already happened, but you are trying to bring these things to the normal, which is a very, very tough and very big thing. But when you achieve this, really, it's a big thing, and you will have great feeling of that you have done something for someone, right? So we have to keep trying and trying. They will have immediately same kind of emergency, and maybe they will survive that patient. So we will continue with video.
Carries you through the rest of the year. And now I'm realizing in fourth year, the progression from excitement to oh shit to I'm responsible. Now it's just sobering.
It's heavy.
It's sobering, yes. It's stressful and sobering.
What's her last rhythm? Take the board. Last rhythm was B-fib at the door. We pulled her in. Move her over. What's the street? She's back in B-fib.
I'm not feeling a pulse down here.
Pads, please, right away. CPR right away.
69-year-old lady, they found her without pulses, not breathing, completely unresponsive. And they brought her in here.
Everybody clear? Are the paddles attached?
Paddles clear. Everybody clear.
Clear. Shock. Continue CPR. 200. All right, charging. Keep doing CPR.
I was actually leading the code. You carry the whole burden of responsibility of like organizing all the people that are in there, making sure that everyone's doing everything appropriately, making sure the gap between thinking and acting is minimal.
We got good color changes.
1 amp, calcium carb, calcium chloride. 1 amp bicarb. All right, hold CPR. Hold quick pulse check, rhythm check.
A lot of multitasking, and meanwhile, like dealing with the family, talking with the family, being their emotional support.
So the daughter is outside, right in these chairs.
What time is the last epi?
Before you pronounce, it's usually good to go out and tell her that things aren't going well, so that she's ready for what you're going to do.
Okay. All right.
Just so you know, she's sitting in those chairs.
Okay. Thank you.
You know, people say that in the ER, like you see patients for a few minutes and you never see them again. But you know, I think the relationships you develop in those few minutes, where someone's really, really sick or on the edge of death, or where they actually don't make it, are it's the most important interactions that you'll have with your patients and with their families.
Unfortunately, right now, it doesn't look like she's doing that well. We have been resuscitating her for about 15 minutes now, and she hasn't responded. Her heart isn't beating. We're still doing CPR on her right now and giving her all the appropriate medications and treatment, but it isn't looking that good right now. I have a hard time separating myself from it. I lost like both of my grandfathers in like the last 2 years, and every time I...
This is very tricky, very sad, and most hard part of the emergency room, that you have done everything for a patient. Everything. But you haven't succeeded in that. You can convince yourself, but it's very tough to convince some relatives, some near ones, that we have done everything, but that person is not survived. So for a very little time, they will be with you, but you have to develop a skill in you, as a human being even, that sympathies and empathies you have to create for patients' relatives. And you have to give some time to patient's relative to convince them that outcome is not good, and we have not succeeded in that part. We see tears many times. So it's very hard also. One case in my mind just now has arrived. One day I had a patient who had heart was stopped already. We were trying on that. And immediately at that time, the second patient came. He was also unconscious, and he was like about to die. We checked that patient's sugar, and sugar was only 10, which is very low, very low. So we gave the glucose and supportive treatment and all that things. Immediately, within half an hour, that patient was fully conscious. But by that time, we were trying to survive that first patient also. Both relatives were there. Both relatives were there. And when we declared that first patient hasn't survived, that relative told me that, डॉक्टर साहब आप तो कुछ भी कर सकते हो, वो अभी आया था वो भी ऐसा ही था ना, वो तो अभी खड़ा हो गया, आप इनको भी खड़ा कर सकते हो. See, it's very easy to say here, but it's very hard to face over there. This is a little bit negative part, but when you get success in this, many times you will get success. The blessings, you will get the blessings from the relatives and patient. Nothing can come to compare that thing. No money, nothing. So this is the thing, this is the emergency room. We will continue with some other things, like this is the emergencies, right? But all the times we do not have the emergency cases. As I told you, we can have fever patient, we can have minor abrasion patient. कई लोग चाहेंगे सर फांस घुसी गई છે કાઢ્યા પોને એટલે એવું પણ આવે. So we have to prioritize the patient.
See something like that, it's still
Next video.
And when you've got
So this
300
is
people
called
tonight
the
in the waiting
triad
room,
system.
you have to decide how you're going to manage this, how you're going to see these people, in what order. And so we developed a numerical score that many ERs adopt that's based 1, 2, 3, and 4. 4 is, I have a cold, I have a broken finger. 3 is, I have the flu. 2 is...
This is called the triad system. We have a color coding system that black, red, yellow, green. The black patients are already like, you cannot do anything in that. Rare patients require immediate treatment. The yellow, you can treat them little bit later on. And green can sit for hours. They are just doing their routine things. So we have to prioritize our patients also. Some feel bad, some feel good that हाँ डॉक्टर साहब ने मुझे तुरंत देख लिया. सब कुछ बोलेंगे अरे 2 घंटे से बैठे हैं हमें नहीं देख रहे हैं. But we have to just accept it and we have to let it go. And patients also has to accept it that yes, they were busy with emergencies. Next video, please.
I might have an
Mesa Diablo. Si quieres rezar, te voy a esperar, te voy a esperar. Que tomo yo, por la tristeza.
Which one is he on your track?
Son mi dolor. I just gotta kill him. 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 No, please don't put it in. Please. I don't want to talk to my auntie. I want to talk to my auntie, please. Get her on the phone. I want to talk to my auntie.
What's her number?
I just gotta kill him.
Hold
Turn the light on.
Alright.
બધાને હસવું આવે છે. અમને પણ ત્યારે હસવું આવે, પણ આવા પેશન્ટ આવે ત્યારે હસી ના શકાય. સો ધીસ ઇઝ ધ થિંગ કે ઓલ ધ ટાઈમ તમારે CPR આપવાની જરૂર ના પડે. આવા પેશન્ટ્સ પણ આવે કે some are threatening, like second patient is threatened. He can hit you like anything. If you go nearby him, that person will hit you or something like that. And some funny patients are also there. So we have to be like, this is little bit relaxing time for us. Okay, this can be handled later on, or these are okay people, right?
Really bad.
The emergency doc is the family medicine doc of the modern era in a lot of ways, especially at a county hospital. And I fell in love with it. You know, you get to solve all problems, you know, whether adjusting their diabetes medications or fixing their laceration or saving their life.
You're seeing the effects of.
So you can have this kind of cute babies also. And like people like me, I cannot refuse that I won't see that patient or anything, whether they have emergency or not. This baby had little bit rash, 2-3 pink spots on the skin. It's not an emergency, right? But they have come to emergency room, and we have to just talk with patient's relative, and we have to play with the baby, and we have to just ensure them that it's nothing. You can stay at home and she will be fine. You can consult your pediatrician, that's it. But we have to face this kind of emergencies also, in brackets. Next video.
Your training and.
A 5-year-old boy coming out of a car accident or with some other type of injury and having to be next to someone in alcohol withdrawal who's, you know, all over the gurney and obviously going to be pretty frightening for that kid. That's not fair, and I don't think it was fair for the families who had to come in and visit someone who was critically ill and see, you know, that they had to sort of put up with all the chaos that was going on here.
I had someone whose mother had died. And I had to show the body to them to help them to the healing process. And I took that poor woman, I stuck her there in booth 17, where we kept the urinals and the bedpans, and there I showed her mother. And next door there was a man saying, shit, fuck, cunt, because he was psychotic. In the midst of that,
So we can have like routine patients, non-emergent patient with emergency patient. They both can be on the same booth, same bed, like nearby beds. And it's very hard for like one side you are saving someone's life, and the second patient is not like he's having or she's having emergency, definitely, but not that kind of emergency, or she is not having life-threatening emergency. But we have to handle both simultaneously, because everyone wants emergency treatment, immediate treatment, and we have to handle them. We have to talk with patient also, that this is the things we have facing, we have to follow, right? The next video.
showed her mother.
Sick.
Ultimately, when you see our waiting room, when you see people suffering, when you see other human beings in our country suffering, you go, you know, I just don't see how this equates to, at the end of the day, a business and money. And I sometimes wish I could share that with anyone who wants to talk about healthcare. Before we even debate about Republican or Democrat or Obamacare or not, or whatever, wherever you stand on that this notion of, look, you know, at some point, it really is just about doing the right thing for somebody.
A lot of people have no idea, you know, what a county hospital is, or even what it stands for, or what goes on here. There are many people that have perceptions that county hospitals are all filled with only illegal immigrants, and they're quite shocked when they come here and find a different reality. We see a lot of working poor. We see people willing to wait 15 to 20 hours and not going to work that day because they need to.
With treating the patients, we need to do documentation also. It's very important for all of you. Make a habit of doing documentation from right now, because nowadays there are so many medical legal problems there. Even in other fields, there are so many legal problems you can face. So you have to develop the talent and skills to do the documentation proper also. In emergency, we do one thing, that we see the patient first and then do the documentation. In other things, we have to do simultaneous documentation. But emergency room, it's okay, we can do later on. One more thing, in emergency room, we do not ask for money immediately. Even government and private hospitals have now policies that emergency care patients must be treated without asking a money, single money. And I'm working with a corporate hospital, SCG hospital, and in that hospital even, I have treated many patients without asking any money. And after giving the 6-8 hours treatment, after stabilization, we have shifted to the civil hospital or VS hospital. But emergency treatment we have provided. Many hospitals like HCG and government hospitals also have foundations who are helping poor people to get an immediate treatment and emergency treatment. So you have to be very honest to yourself also. You have to give sympathies to that patient also. You have to ensure that patient that if he doesn't have any money, then even he is going to be treated.
Get medical care.
Next video. 1 minute.
Continue doing your assessment.
Now you have done everything, right? Everything. We saw negative things, all the negative things. How you will feel that one person has brought dead, almost dead. You work for an hour on that patient, and that patient has survived. How you will feel, how you will express that thing, that patient, that person is standing in front of you after 15-20 days. Believe me, it's a very good feeling, very, and blessings from relatives, you can't imagine, because there is nothing more than life, right? Everyone is earning, eating, everything for life, because I want to live life, right? So in this video, we will see how they feel, that how that person has survived and he's in front of them. Please.
It's now 30 minutes in, saying, man, this is not looking good.
All right, we're charged. Jules. You got that heavy? Everybody clear?
You're now at an hour into the code, and you say, listen, this is futile. So it turns out that sometimes crazy things happen, and some patients survive, and they actually become a big part of your life. And so I'd actually like you to meet Ralph, who is this patient. Ralph, can you come on down?
I think it's really easy to see a story like this and say, that was a miracle, but...
So this is the emergency room. And seriously, every month, at least, we are trying to save 10 lives in a month, at least. We have succeeded in that thing. So in future, even if you will be in emergency medicine, then you will count as an achievement. These achievements, you won't find any trophies or anything, but self-achievements, self-respect and self-satisfaction will be there. One day I can be even old and sick, and that time I will have to come to emergency room. And I hope that time I can find one of you, some intelligent and talented doctor over there, and who can treat me nicely and can save my life. Thank you very much for all of you. And I will thank Ashirwad Trust and Sir for giving me such opportunity. All the best, students, for your career. Thank you.